Hello, my name is Samantha McCoskey. My presentation is over Dexcom in the healthcare setting for NU 547 Healthcare Informatics. During this presentation, I will be explaining what exactly a Dexcom monitor is and how it is used in the healthcare setting, applications for use of the Dexcom monitor, the relevance to the healthcare setting, the benefits of the Dexcom monitor, as well as concerns with using a Dexcom monitor, and then the relevant stakeholders when it comes to using the Dexcom monitor in the healthcare setting. What is a Dexcom monitor? Dexcom glucose monitor wearable is a technology that assists people diagnosed with diabetes to track their blood sugar levels. This is an AI-assisted technology with a sensor inserted under the skin that transmits the information to the smartwatch or the smartphone. Traditional blood sugar meters entail drawing blood from the finger, testing it, and checking blood sugar levels. With this new technology, patients can have real-time information that can help them know which food they are supposed to eat and whether they are required to exercise. The Dexcom monitor is a device typically understood to be composed of a sensor, a transmitter, and a receiver or monitor, again, placed under the skin with a lifespan of approximately 10 to 15 days per monitor. When it comes to healthcare, patients must be aware of their health situations at all times to take necessary corrective actions. Hospital trips to check blood sugar levels can be strenuous, and it can become difficult to conduct regular checkups. For this reason, the Dexcom glucose monitor wearable is a roadmap towards understanding lifestyle and behavior. When searching for literature on Dexcom glucose monitor wearable, I used databases such as Google Scholar, PubMed, CINAHL. The keywords I searched through the databases included diabetic glucose monitoring, diabetes, Dexcom. The idea here is to ensure that I use keywords that were likely to register results with the most corresponding journal articles that address the subject matter. I set my results to be published articles within the last 5 years. Before setting the date range, the cumulative results of the databases were 2,190. After setting the results for the last 5 years, the results were 1,360 across all databases. My idea of limiting the results to the last 5 years is to ensure that I select current publications that contain accurate and updated aspects of the new technology. I pursued through the results and decided to remain with the ones that contain words such as diabetic glucose monitoring, diabetes, and Dexcom. Dexcom glucose monitor has changed how diabetes is managed in healthcare. Most people are always keen to be aware of their health status. The contemporary marketplace is filled with foods that are not healthy, leading to conditions such as diabetes. Due to the fact that healthy foods are expensive, most people are prone to other severe health conditions. For this reason, continuous monitoring provides information about an individual's blood sugar levels that helps in giving insights into the proper management of the condition. One of the Dexcom glucose monitor's core functions is to assist in improving glycemic control. It is important to note that the individual diagnosed with diabetes needs to control their sugar levels as part of the ways to ensure that the effects of the condition are not adverse. A system that alerts them of hypoglycemic episodes guides them to be alert and take corrective action promptly. Data collection through technology can help assess the most appropriate treatment plans. The real-time information empowers patients to take corrective actions about their health, diet, and exercise. When patients have proper glycemic control, they can reduce their diabetes medication intake as their doctor advises. The advanced practice nurse can study the glucose trends and patterns and work in conjunction with nutritionists to develop proper diets for the patient as well. And it also reduces the advanced practice nurse workload while allowing for remote monitoring. That there are other models other than the Dexcom monitor for glycemic control. There's a Dexcom G6 and a Dexcom G7. Both are good for ages 2 years and older. Where the Dexcom G6 is for type 1 diabetics, the Dexcom G7 is for both type 1 and type 2 diabetics, as well as gestational diabetics. Both can be worn in the upper buttocks, but only the Dexcom G6 can be worn in the abdomen, where the Dexcom G7 can be worn on the upper arm. The sensor lifespan for the two ranges between 10 to 15 days, and there's no prescription required for these. Now, the other two models that are not Dexcom models, but they're similar in style, is the Freestyle Libre and the Medtronic Guardian Connect. The Freestyle is for 18 years and older, where the Medtronic Guardian Connect is for 14 to 75 years. It puts an age cap on it. Both are for type 1 and type 2 diabetics. The Freestyle you can wear in the upper arm, where the Medtronic you can wear in the arm or the abdomen. The sensor lifespan on this ranges between 7 and 14 days depending on the model, and this one does require a prescription. This slide is demonstrative of the differences between the Dexcom G6 and the Dexcom G7. For the Dexcom G6, the lifespan is 10 days with a warm-up period of 2 hours. It is not suitable for pregnancy, and it is water resistant up to 2.4 meters. The alerts that it has are customizable sound and volume, high and low alerts, urgent low alert, and you can make an alert schedule. And you can wear this in the abdomen, upper buttocks for kids ages 2 to 17 years old. Whereas the Dexcom G7 has a lifespan also of 10 days, a warm-up period of only 30 minutes. You can wear this if you're pregnant. It also has a water resistance level up to 2.4 meters. And the alerts are basically the same. Customizable sound and volume, high and low alerts, urgent low alert, a delay first alert is the difference, along with an alert schedule can be made. And you can wear this on the back of the arm, upper buttocks for kids 2 to 6 years old. In the contemporary era, where people are diagnosed with lifestyle diseases, diabetes has become the most common. Since many people are diagnosed with the condition, Dexcom Glucose Monitor is a technology that helps diabetic patients be updated on their glucose levels to help them make appropriate decisions in the form of diet or engaging in exercise. Although technology has been crucial in presenting real-time patient monitoring as a benefit, it does attract concerns regarding its safety among its stakeholders. Some of the benefits of the Dexcom monitor include being suitable for children and people who are pregnant, depending on the style of the monitor, that this device does not require finger pricking. It does offer real-time alerts, which can allow patients to receive warnings anytime their glucose levels go beyond or below what is recommended. The idea is to ensure that patients are kept safe and warned when things are not what they should be in regard to the glucose levels. The alert system is crucial because it allows someone to go to a healthcare facility to seek a physician's advice if needed. The sensors and transmitters are also water resistant, and whereas finger sticks can be uncomfortable, especially if one checks their sugar level several times a day, another benefit is that the technology is psychologically comfortable for patients. The technology reduces the burden of diabetes management. Concerns or the cons surrounding the Dexcom monitor revolve around the fact that the sensor can be manipulated and register inaccurate results. If the glucose alerts do not match the Dexcom readings, a person may have to use a finger prick blood glucose monitor in addition to their Dexcom. Although the technology is reliable most of the time, there is possibility that calibration needs to be done regularly to eliminate the possibility of inaccuracies. Another concern is the cost. The technology is expensive, and most people whose insurance cannot cover it will not be able to have the opportunity to use it. This disparity in healthcare access creates a problem of the widening gap that compromises the overall public health outcomes. The last concern of the technology is how the stream of data generated can confuse its users if not educated properly on the device. And not all smartphones may be compatible with the monitor, and a separate compatible smartphone may need to be purchased, that going along with the costs of the system. The Dexcom ecosystem comprises an array of stakeholders, with patients at the forefront. Patients are the beneficiaries of the technology. Healthcare providers are also involved because they play the leading role in educating patients on how to interpret the technology whenever it gives an alert. They ensure that they also keep track on the progress of the patients and if an increase or reduction in medication is warranted. Pharmaceutical companies are also among the stakeholders because they manufacture diabetic medications. The insurance companies are involved because they ensure that the patient's cost in acquiring the technology is covered. Lastly, the manufacturer of a Dexcom technology is responsible for ensuring the accuracy, usability, and the quality of the product meet the end user's needs. In conclusion, technology has significantly improved diabetic management. It has enabled patients to be informed of their health and help them make choices that are critical to their health. While the technology ensures accuracy and creates comfortability, it is associated with cost, accuracy, and information overload concerns. Patients, healthcare professionals, and technology manufacturers can collaborate to promote innovation with the Dexcom device. Advanced practice nurses can use the data from the technology to tailor treatment for the patient as well as using it for patient education.